Okay, this video is about the four worlds of health and how you can get the best outcomes for yourself. So basically, the third world is mostly tropical countries. Okay, it's real hot and you got all these mosquitoes all year round. You got intestinal parasites, lots of people dying of malaria. You usually have some type of banana republic dictator. Almost every country in the world other than the ancient Greeks and the modern Christian countries, basically there's some dictator who says, do as I say or I'll kick your butt. And so people often die from infectious diseases or violent behavior. Okay, that's pretty common in those areas. Now, if you're in the East, and these are like very much communist countries. When we say East, we mean things like Russia or China or North Korea, stuff like that. So basically, you got some communist tyrant who anybody tells the truth, they shoot them. Okay, or they'll put you in a concentration camp and they'll freeze you to death, okay? Or they'll starve you to death, okay? They love to starve big populations of people, okay? So that's, when you say the word communism, it's almost like saying starvation in the next sentence because it's very routine that they use it as a method to get rid of people, okay? They'll burn down the forest, then they'll all of a sudden cause a famine and everybody's screwed. So that's how you die over there, all right? Now, in the West, the way most people die in the West is they stuff their face with high-fat diets and processed food. Okay, we've got indoor heating to prevent you from freezing to death. We've got sanitation antibiotics to prevent most infections. But the typical chump just, the old saying is they dig their grave with their own fork and their knife. Lots of high-fat food, lots of processed food, tons and tons of animal protein, and they cause all the common diseases we know that bump people off every day. Obesity, hypertension, diabetes, cancer, autoimmune disease, kidney failure, etc. Okay. In the West, where people eat a low-fat plant-based diet, organic only, whole food, no oil, they get the best of both worlds. They get all the advantages of the West without getting the Western diseases from the high-fat, high-animal food, high-processed food diets. And that's how you win the game. And it's not debatable. All this paleo, keto, carnivore stuff is fake. All this high-fat, phony Mediterranean diet stuff is fake. And it's obvious if you think about it. How did Kempner cure all these patients? With the lowest possible fat he could get them on, about 3% of calories from fat. The Mediterranean diet, the way it's talked about, even by the vegan influencers, is about 40% of calories from fat. That's more than 10 times as much fat. Animal studies to prevent atherosclerosis, reverse atherosclerosis, and diabetes. You minimize dietary fat. Okay, look at the Asians back when they ate 85 or more percentage of the calories from white rice, which has only 1% of calories of fat. 1 billion out of 1 billion were skinny with no hypertension, no diabetes, and then they don't get coronary artery disease in that sense either. And the same diet that causes the hypertension, diabetes, obesity, it also causes ischemia of the tissues, lack of oxygen delivery, so it causes cancer. It also causes leaky gut, so it causes autoimmune disease. And all of these things go together and they cause increased risk of kidney failure, blindness, stroke. They all go together. Whereas you can avoid that stuff dramatically or reduce it dramatically. You can put hypertension and type 2 diabetes almost to zero, obesity to zero. Okay, you can dramatically minimize your risk of cancer, autoimmune disease, kidney failure. There are still some rare things that can happen, but you got a much better odd. And it's always this way. And the other thing too is most people, they refuse to even give it a try or a thought. What I would say is, why not try it for 3 months, see what happens? Work with your doctor if you're on medications to titrate down the dosages, especially for diabetes, for hypertension, or anticoagulants. But why not go for it? So anyways, this is how it works. This is the big game. And all the epidemiology correlates for this. You can look at the Asian studies. You can look at the Asian migration studies. You can look at the World War I, World War II, where there were restricted diets available. There were like very limited food stuff away. They would take away the meat, take away the oils, and the people would get healthier despite the severe stress. You can look at Finland with Pekka Puska, Dr. Pekka Puska, reversing their coronary artery disease risk by 87% by getting the fat out of the diet, the animal foods out of the diet. He also got them to quit smoking. All right, but it made a giant difference. You can look at Okinawa. You can look at Tarahumara versus Pima. You can look at, anytime you look at these big plant-based studies of people eating really, truly low-fat. When I say low-fat plant-based, I mean less than 10%. Some people say I should call that very low-fat percent. But, Walter Kempner was about 3% of fat. Pritikin was about 10% of fat. McDougall was about 7% or less of fat. Esselstyn was less than 10% of fat. My Spartan vegan version of it is about 5% or less of the calories from fat. So anyways, that's how it works. So you want to end up in this camp because that's what makes people the healthiest, and it's pretty easy to do once you know how the game works. Anyways, hope you found that helpful.